What I actually wanted to start with was that, let's see, how many days ago? It was on November 2nd, I ran the New York City Marathon to celebrate my 50th birthday, Patrick, on Monday. And I thought the winds on the Verrazano Bridge were freezing. My knees are knocking. I am so cold in here. So thank you so much, Frank, for reminding me of that. I also want to say that this morning has been very interesting to me. The first speakers were just really incredible. I didn't know, I was feeling like, is this my comfort zone? My comfort zone is usually in a classroom with a group of boys who are looking at me with their, wanting to have their pants hanging down and me looking at them with a very stern look, or being on 129th Street in the middle of the St. Nicholas projects talking to a group of grandmothers. But I really felt like this was a comfort zone for me this morning. And Tony, I don't know if I am a friend of Evidence, but I am definitely a groupie now. So I am going to be, I was taking notes and I was really excited about all of the things that you were talking about. And one of the things that it reminded me is because at the Harlem Children's Zone, and for all of us, this is not an intellectual or theoretical conversation, right? This is about the children and the families that we work with every day. So it makes this conversation so important to us. So the history of what has happened at the Harlem Children's Zone, people talk about the charter school, or they talk about one particular program, but I want to tell you two things about my day yesterday. So in the morning, we spent 3 hours talking about, it was probably 40 children, Bettina. And it was 40 children who are in our early childhood program. Because we want to speak and talk about them and think about them right now. It is November, so they have just taken their Bracken and their Brigance. So we're able to see who's delayed and who's very delayed and who's average and who is advanced. We put together those conversations, we look at the data, and then we talk about their families. We know who's living in a homeless shelter. We know whose mom just had a domestic violence incident in their house last week. We know the plans that we're going to have for each one of those children. And then we make sure that we're implementing those plans to get each and every one of those young people to be 100% school ready by the end of the school year. But let me tell you something. Just recently, as we looked at some of our third grade scores, we compared how our Harlem Gems do in comparison to young people in the community who didn't go through that Gems program. And what we found, well, I didn't do it. My hotshot director of evaluation, Dr. Bettina Jean-Louis, who's here with me today, did it. And I said, how did the kids look, Bettina? And she said, they actually looked the same, which was not what we were expecting. We thought that those kids that went through our year-long program in our early childhood program would look different. And so we're now in the process of trying to figure out, is there something more rigorous we need to do so that when kids take that third year exam, that the GEMS kids should look a little better. That's one of my examples today of the fact that we could have stopped with, they're 100% school ready, people love us, we get to say that every year, isn't that wonderful? But we are constantly going deeper because there's a sense of urgency for us, right? This is not just about being able to say to the world that we're just a great organization. It's about us making sure every single moment, every single time, for every single child, that we're getting it right. The other example I wanted to give you was yesterday. Also, Bettina and I were in a conversation about our young people who are in college. I'm not sure if all of you know that our pipeline really does go from baby college to college, and right now we have 881 young people who are in college. Not that I'm counting every single one. And that's a great story, and we're doing a lot of great work with them. But I also know, and what many people don't know, is that we have 200 of them that are not in school right now. And we want to find out what needs to be happening for those young people. So as was mentioned this morning, we have the folks that work in our CSO office, our College Success Office, that know these young people. We also know them because they were in our high school program. So we know them by name, we know their backgrounds. And we also know that there were some of my staff that when they sent them to college, had a little thing in their back of their head and never really thought that they were going to be successful in the first place. So we've decided to start our own innovation of those young people and came up with what was going to be our theory of change. What is that going to look like? What's our logic model? And worked with Bettina and her crew and the folks that worked in the CSO office to say, what would a pilot look like if we could dream for these young people and had deeper conversations with them? So of course, we're going to focus on academics, but we're also going to focus on those academic behaviors, those feelings of I don't belong here, those feelings of I don't want to disappoint Mr. Canada and Miss Ann, and so that's the only reason I'm going to college. And to really spend some extra time with them to see if we can figure out what needs to be happening for these young people so that they can be successful. Those are two examples. We have evidence-based programs in some of our early childhood programs. We have an RCT that we're doing with our Promise Academy young people right now. We're working with Mathematica to do some work around childhood obesity, because I can't get them to college and then have them come back into the community and have diabetes and strokes and all of those things. So I'm so proud that the Harlem Children's Zone, as I was sitting here, feels like we're amongst friends and people who are concerned about what's going on the ground for our young people. So that's what this panel is going to be about this morning. So if you guys will do me a favor and introduce yourselves, tell a little bit about your organization, and then we're going to get deeply into this conversation.
Want to start with me?
Yes, I do.
All right.
Ms. Sandra.
Good morning. My name is Sandra Samuels. I'm president and CEO of the Northside Achievement Zone, and we are a federal promise neighborhood. And we received $28 million about 3 years ago. We are in a third year of a 5-year grant. And really all of the promise neighborhoods really used Harlem Children's Zone as our evidence of why not in our footprint as well, of being able to create a cradle to college pipeline and to eradicate the cradle to prison, cradle to the grave. And I want to start by, what we've been doing in terms of building evidence in our footprint wouldn't be possible without PolicyLink, Harlem Children's Zone, and the Center for Social Policy, and of course the Department of Education that gave us the funding. And so I just really want to thank all of you, because what we are doing in North Minneapolis, and North Minneapolis is a racially concentrated area of poverty. We have a bunch of neighborhoods. In fact, there are 38 recaps in Minneapolis, and North Minneapolis has 20 of them. And we make up only about 15% of the entire city. And so about 50 organizations got together, again, even before we got the funding, and decided that we did want to replicate Harlem Children's Zone, that we would create a cradle to college pipeline, and that we would use evidence to do that. Multi-sector, cross-agency alignment of our contributions, our resources, our time, our strategies, our data collection systems, and our evidence. And we've been doing that ever since. Today we have about 600 families who are in our pipeline of success, who are getting this whole ecosystem of support, whole family wraparound, education pipeline, as well as whole family support. And we have around 1,600 scholars. We call all our babies scholars because we really want to get at that belief gap, who are 0 to 18. And we have really been seeing some incredible early outcomes from the 30 anchor partners and 9 anchor schools, really taking a disciplined approach with the same North Star of ending multi-generational poverty, using education as a lever, and really creating this culture of success in a place where all of the disparities in Minneapolis, where we are, is really ground zero. And this is really important to me, and using evidence, because North Minneapolis has been a place that the government and other philanthropists have invested hundreds of millions of dollars to end poverty, and it hasn't happened, right? And I've been living in the neighborhood for about 17 years, and without real evidence, we won't be able to, one, continue the good work that we've started. And it has been incredible. I'll tell you some about that in terms of our early childhood numbers, our reading, so on and so forth. And we will not also be able to sustain our work because the philanthropic and the government sector are starting to, anyway, look at who's really producing outcomes. Not fast enough, but they are.
And I'm going to come back and ask each one of you what types of evidence you use and what does that look like. So let's go to Dr. Rowley.
Sure. So I'm Robert Kahn. I'm a pediatrician and extra training in public health. And I'm a professor of pediatrics at Cincinnati Children's Hospital. And I help run the hospital's population health initiative. And just to give you a sense of the context in which we work, Cincinnati Children's Hospital has grown tremendously over the last 10 or 12 years. It's about 30,000 admissions per year, over 1 million patient encounters per year. So you can imagine the complexity of creating change in that environment. And we can go a little bit more into that later. I think Tony captured it really well, this sort of spirit of improvement. So I just want to say that the vision statement for Cincinnati Children's, and every chair, CEO, trustee, senior leader will say, it's to be the leader in improving child health. And I'll say I came from Boston, and some of my mentors are here from Boston. And there is this sense that it's not to be number one, it's to be the best at getting better. And almost anybody at any sort of leadership level knows that as a vision statement. So why is the work important? It's many of the correlated health outcomes to what you've discussed, which is how do we close the health gap? Right, tremendous health gaps that we really have not made great progress in. For all the drops in infant mortality, the gaps remain. So that's one of our stretch areas, is really to think about how to move into the community and partner with the community to address the gaps. The bread and butter that we're working on in quality includes safety, and that was triggered, as mentioned earlier, by that Crossing the Quality Chasm report and help from Robert Wood Johnson. But it's gone from safety to really thinking about optimizing quality of life and outcomes for kids with chronic conditions, now to moving more and more out into the community and thinking about these conditions that are very socially and environmentally driven. So it's bringing all these techniques through that path.
Great. Maria Pena?
Great, thank you. First of all, I'd like to say thank you to Lee and to Frank Coops and the Friends of Evidence for having me here. I think some of you might know that, thank you so much, Kirsten Little, my CEO, was meant to be here. She has unfortunately fallen sick, so it was going to be her honor to be here, but now it gets to be mine. So I'd like to maybe just deviate from my planned remarks a little bit and tell a little bit of a story about who we are as an organization. I work for an organization called LIFT. And for those of you who saw a little bit in the background paper about who we are and what we do, you know that we are a national nonprofit that works in 8 high-poverty neighborhoods, 6 major cities around the country, to help individuals and their families lift themselves out of poverty for good, which is, of course, when you say it out loud, is an incredibly audacious and ambitious goal. Maybe to help bring that a little bit more to life, I'd love to share just a little bit of a story of a board meeting, a national board meeting that I recently spoke at just 2 weeks ago with our national board at LIFT. And I was asked to tell a story of the work that we do with our members, because I think some of the work that we do in anti-poverty, you'll see why, is a little bit harder to understand unless you see an example. So I gave an example from my own work in member service. So in addition to being chief program officer, where I lead program design and innovation and evaluation, I also work 1 day a week in one of our service centers in DC, working as a volunteer advocate, working one-on-one with low-income community members, so I can stay close to the program, really see the effect of the changes that we're making in the program, and get a realistic idea of what implementation looks like day to day. Enough said. So I work as a volunteer advocate, and there is a woman that I've been working with for several months, Mrs. L, I'll refer to her as. She came into our LIFT offices in a real shaky ground moment. She had recently left her husband after one of several really terrible domestic violence incidents. She left pretty much in the middle of the night with just the clothes on her back and her 10-month-old baby, who was 10 months old. Although she brought her into the service center, she really looks like a newborn, tiny, with a little pink feeding tube coming out of her nose. And in the course of her work with us, she divulged information about what was really a precarious situation, which is not only was she a new immigrant from Morocco, speaking beautiful Arabic and French, but not that much English, but she was cut off from her social network that she had built with her husband. She had no income, she had no real support network, and her child was sick. And without her husband, she did not have access to medical care. And her medical condition was so dire that without proper medications and operation, it would get even more serious. She was withering away. And so we had a complex set of issues that this woman and her child were dealing with around healthcare, around employment, around housing. They were now homeless, and a whole host of psychological issues that need to be dealt with as a result of the domestic violence situation, as well as the legal issues. But the biggest priority for Mrs. L was getting health care for her child. And so long story short, we spent a number of weeks trying to figure out how to get this woman to enroll her child into Medicaid, which if you are involved in the social services system at all in DC, you know that we have a 6-month backlog for applications. And her child needed medication within weeks. She was 3-4 weeks away from running out of medication, really needed the operation. And so after many attempts to go through the regular process and getting turned down, we called Economic Security Administration and we said to them, look, this situation is really serious. How do we get this application expedited? This child needs the operation. And the woman, the ESA rep, who was very nice, but clearly set to deliver a certain set of statements, said, look, if the situation is dire, go to the hospital, get the operation, incur the bills, and just hope at some point in the future this gets covered retroactively. But for a woman who needs to get a job, needs to get an apartment, that kind of devastation to her credit as a first course of action, devastating. And so we try this another way. And so, one of the things that we think about at Lyft is that the shortest distance between two people is a story. And so we tried to connect with the ESA rep in a different way and really explained the situation, the domestic violence situation, and really the quest that this mother was on. And everything changed when we asked that ESA rep for help. And what she told us to do was to go back to the ESA service center, told us which one to go to, told us what to say, told us to ask for a supervisor who were the only ones who could expedite the applications, and then to ask for that application to be expedited. And if that didn't work, call 311, say this, ask for a supervisor, ask to get it expedited, and do those two things over and over and over again until it worked, until the baby
Dr.
got
Rob
care.
laugh.
Exactly. And long story short, 2 weeks later, even though there's a 6-month backlog in DC, 2 weeks later, Mrs. L came back and Medicaid had been approved. And her child had the medication, and she had the feeding tubes, and her operation was scheduled the next day. And she was even able to find a small part-time job and a room to rent where now her child could live instead of the shelter. All of that is to just paint a portrait of really the complexity of poverty of the members that we deal with. We call them members, and really the challenge of creating an intervention that reliably helps people lift themselves out of poverty when everybody's goals and priorities and challenges and needs and aspirations are different. And that's one of the reasons why I'm so excited to really take this evidence-based approach as we think about serving 8, 9, 10,000 people a year. How can we get even smarter about using evidence to say what are the systems and processes that underlie our work, and how can, even though each person's situation is different, be much more smart and effective about how we achieve results?
Yes, what did Tony say? Learning faster and achieving results, better results, reliable outcomes at scale. In your package, there is a handout that I wanted to mention to you guys because it was in the material that was sent out around using evidence in complex change efforts. I'm not going to go through them, but it's sort of many sources of evidence-informed intervention. Results shape implementation. Goal-oriented networks accelerate knowledge development and dissemination. 4, multiple evaluation methods fit diverse purposes. And 5, a strong infrastructure supports continuous learning for improvement over time. So I want to talk a little bit about evidence and this idea that there's a range of evidence that one can use in order for these complex change efforts that you all are doing. And tell me a little bit about what evidence you're using and how you obtain it. Dr. Rob, should we start with you?
Sure. So whether it's reducing errors or ensuring a patient with cystic fibrosis or inflammatory bowel disease is getting the best therapy, or a child with asthma is on Flovent, I think there has absolutely been a role for randomized controlled trials. For any one of those areas, you can find trials out there, and I think the point of this conference and where we've tried to take the work is just what Tony said. Okay, so now you know Flovent is the right answer for a child whose lungs are inflamed, and the RCT would say make sure every single child with asthma who's having a hard time has Flovent. It does not begin to get at the complexity of all the determinants of what's causing the morbidity around the asthma, and as you step out further and further and further upstream, it is that complexity and that multi-layered set of influences. So that's where we've turned to very much the model that Tony and Charlie and others work with, which is this, at its simplest level, I like to use that model for improvement. It's those 3 questions. What are we trying to achieve? How will we know if we get there? And what are we going to try to do it? And it's that last piece, I think, where you start to go deep. What is the existing evidence? And what's the gap? And before you immediately try to fill the gap, what is that larger system? And I would say the last component of that is just what you were emphasizing earlier, is talking to the families on the front line. Don't assume that Dr. Rob, in his exam room with 30 patients, immediately knows what would actually help that family. So it's in that framework of learning and learning at the front lines that we've really tried to expand the level of evidence And even in that final step, I would say, where we're pushing further and further is this notion of user-centered design, ethnography, much more iterative trials starting with one. If it works for one, you perturb the system. You figure out for one, what made it work. If it worked, how do you get to 5, 25, 125? So again, it's really, rather than I write my NIH grant, I would add about 12 years to what Tony presented. It took 2 years to write the grant and get it funded, missing the pay line at 10%.
While the kids wait.
Getting it published at a journal that has high impact, because that's what my chair wants. So I think versus, I'm going to try it for one, all right? If it's legal aid that child really needs because of the bad housing, I'm going to establish a relationship with the intake at legal aid. If I can make that work, what would be the next step to get to 525?
Great. And Maria, you did such a great job of telling us a story which tells us a lot about yourself and your organization. How do you use that constituent voice as evidence for what needs to happen and as part of your design for your strategy and your intervention?
Well, just like, as Rob described, his focus on not assuming that we know, just because we are so-called experts, what the most effective intervention would be. We have the exact same philosophy at LIFT. So we have implemented a methodology called constituent voice. It goes by other names. It's basically a participatory feedback methodology that is borrowed, stolen from the corporate world. And I'll just disclose that I am a corporate refugee, having spent about 10 years at big companies like PricewaterhouseCoopers and Ernst & Young and IBM, doing a lot of business process design, and having for several years of my life being very focused on customers. What do customers care about? What do customers want? And as I made the transition to the social change world, I was really struck by how infrequently that was really at the centerpiece of program design and program evaluation. And so when I joined LIFT about a year and a half ago, even though we had been in existence for about 14 years at that point and had just enormous streams of data about things like our members' employment status and income status and dependence and gender and race and all that sort of thing, what we had never done is really ask them what are their needs, to what extent are we meeting them, and we had never taken a look at to what extent their input could really inform program design and delivery and what that could tell us about the effectiveness of our own intervention. So we sort of got wind of a particular brand of the methodology called Constituent Voice that basically uses customer feedback surveys. So those of you who have flown on United Airlines or bought a cup of coffee at Dunkin' Donuts, you'll see a little thing to take a survey at the bottom of your receipt, or you'll get that email from United asking them to rate your experience on the flight. And what you may not always be aware of is the responses to those questions, things like, I would recommend this company brand product service to friends and family. Not only does that help them understand to what extent do people really care about our brand and value our brand, but they use those feedback scores to predict the likelihood that you will buy additional products and services. And they use that information to predict even broader metrics, things like sales and profitability and share of wallet. And so we find this methodology really compelling, and we thought to ourselves, gosh, for a small $9 million organization, relatively scrappy nonprofit that doesn't have a really huge evaluation department. My evaluation department, by the way, is sitting right over there, Department of One, and she's been here 6 months, and before that it was me, in addition to running program. All of that is to say really that this can be done with low effort and low budget, truly. This is not one of those methodologies that you need 20 people and $50 million to do. What we saw was this methodology that says, let's just ask the people we serve, what do they want, and what do they think about the extent to which we meet their needs. So long story short, we implemented this several months ago at the end of 2013. We do small micro surveys. So if you can imagine, our members come into our service centers, they're bricks and mortar service centers in 6 major cities. They come in for about an hour and a half once or twice a week to partner on their goals, like finding a good job with benefits, finding safe and secure housing, obtaining public benefits, that sort of thing. At the end of each of those interactions, we ask them to fill out a short micro-survey, and we actually ask them to fill out the survey before they ever interact with us. It's as they're waiting in the waiting room for their first meeting with us to get a sense of, are they starting strong? We ask them things like, I believe I can achieve my goals, to see sort of what is their mindset coming in. And we take all of this information to say, well, how are we doing? So we ask questions like the would you recommend question, but also things like at Lyft, I'm treated with courtesy, dignity, and respect. People at Lyft really care about me and want to help me the best that they can. At Lyft, I work in the goals and priorities that are most important to me. We care about those scores in and of themselves, and we use that in a way to assess our own performance and identify areas for improvement and learning in our own operations. But we also take that information and we triangulate it against the other data that we collect. Things like, did they actually get the job? Did they actually get into housing? What are the outcomes that are measurable and observable in their lives? And we try to see to what extent, if any, there's a correlation between the two. And happily for us, the sum of it is that we have seen, even though it is very early days, the promise of real predictive analytics. So we have seen a positive correlation between higher scores on these feedback surveys and the likelihood that people, and the magnitude of the economic progress they're able to achieve. So just as one quick example of that, if you think about the scale that we ask people to rate us on, so it's a scale of 0 to 10, just like in the corporate world, 0 completely disagree, to 10 completely agree. We call them promoters. This is exactly what the corporate world uses, the Net Promoter System. Promoters give us the highest scores of 9 or 10. Neutrals give us the relatively good but middle scores of 7 or 8. And detractors are the biggest group of scores at 0 to 6. What we see when we look at the scores is that detractors who give us a 9 or 10 are approximately 3 times more likely to achieve economic progress than people who give us the lowest scores of 0 to 6. So just that survey score that we collect every hour of the day in every city in which we operate, we can start to get like really sensitive data to see what is the likelihood that this person will achieve progress, what is the likelihood that we are in this city going to achieve our goals, what is the likelihood that as an organization we're going to achieve our intended impact. So that's been a real helpful leading indicator for us.
Good. I thought I spoke quickly. You're good. You got it all in now. But I'm watching the clock because I want to get these people involved in the conversation. And I know we're going to do I'm going to have one more question for Sandra, then I'm going to ask you guys for some questions. And then we're going to get you out of here by about 10 after 12. Right, Frank? Good job. Sandra, one of the things that was really interesting about your experience was that when you first started doing your Promise Neighborhood planning, they wanted the best of pieces of evidence available for a birth to college. And in some places, there was not a lot of evidence that was available. So I wondered, how did you choose how your programs were going to be done, and how did you look at those outcomes under those circumstances?
Yeah, thank you, absolutely. There were some strategies that we even got from you all, and you were known for creating your own evidence in terms of doing the work, around, for example, family engagement and using people from the community to actually be family coaches for the families that are in our pipeline, for example. And there just wasn't, and it's a major, because we have a high expectation, high support kind of paradigm for our community. And there wasn't a lot of research that was an efficacious strategy. And so we decided to use what research was there, as well as what lived experiences we had in our own community. And so our family coaches, what we call NAS connectors, are now actually creating our own evidence. And this is throughout our ecosystem, both from early childhood to K through 12 to mentoring, out of school time, housing, career financial pathways, health. These are all, our 30 partners, 9 schools make up this whole ecosystem. And so we have this process, which is really exciting. We call it the NAS Seal of Effectiveness. And where we actually look at, in all of these different areas of the ecosystem, how much have we done, how well have we done it, and is anyone better off? And so we have targets and benchmarks for all of those areas. I'll use one, for example, expanded learning, which is historically called out of school time. And so we had goals of having 500 students who are in academically based out of school time. But the out of school time group came up with their own solution plan or evidence-based practices. They looked at what are the essential ingredients, what are the necessary conditions, and what's the dosage that we need to do to actually have accelerated academic performance in math and reading for all students. And so it was experts from the community, researchers, parents were even involved. And it also got vetted nationally. Promise Neighborhood Institute helped us to do that. The plan came back, we approved it. That's what all of our partners in expanded learning, and we have 6, use. And so we have a whole process where we come back and actually evaluate the fidelity of using that evidence-based plan, or what we call solution plans, called Results NAS. It's a roundtable, and all of our stakeholders come, including our partners. We look at targets, benchmarks, the fidelity with which they use the plan, what our outcomes are, is anyone better off, our children and families. And we learn. You know, the most exciting thing for us is that in real time, we can actually tell a program, we can look at performance level data to say, you haven't hit the mark using this plan. Was the plan wrong? And or are there some places where you weren't faithful to its implementation? And so if you talk to any of our partners on the ground, they will tell you that the real-time data that they're getting, and we're doing progress monitoring, that's part of it. We do RCTs as well in different areas. But what the programs will tell you that is in real time, they can look at the network and see where it's working for children and where it's not, and ask and learn together, ask those questions, and actually change. And just one quick example is our NAS connectors are the ones that make sure our families have butts in seats. So you can have great programs, but if nobody's coming to those programs, it's all for naught, right?
Yep.
And so part of the essential ingredient was that NAS connectors would know who was attending and who was not. But one of the programs that wasn't getting good outcomes actually were not connecting with their NAS connectors right away to say Jaquan hasn't showed up today. Like, we don't want you to wait a week and say Jaquan hasn't showed up. Tell us the same day. And so once they started realizing that they weren't utilizing our ecosystem the way they could, they started doing that and started seeing a change in attendance and therefore performance like that.
Right, and it really affected the practice.
Absolutely.
I was in government for 13 years. I worked at the Administration for Children's Services, and during that time, I became an anti-EKC fellow. And that's when I first learned about this concept of results-based accountability.
Right.
And that question of, is anybody better off? I'm not sure I actually ever asked myself that question through my 13 years of government. And it was one of the, I'm sorry to say that, I'm being honest, and it was one of the things that really attracted me to the Harlem Children's Zone when I thought about what I wanted to do next, because that's a question that we ask ourselves all the time. You could get so caught up in what you think should be working and are not constantly asking yourselves that question. I wanted to know from the audience if anybody else is involved in any sort of complex change efforts that you wanted to add to this conversation before I see if anybody has any questions. I heard a laugh over there. I have those mother ears. Yes, ma'am. I would run down to you with a microphone, but they're making me sick.
Okay, thank you. I work in Montgomery County, Maryland, and I lead an integrated health and human services department. And we have public health, we have behavioral health, we have all of children's services, income supports, homeless services. So it's really a very broad continuum. And we've been trying to do this integration work and ask the question, if we were to do work in a team better, what kind of impact would we have? And how do we know that we're actually creating beneficial impact? And so we started asking the question, beneficial impact. How do you define it? And CPS defines it one way, APS defines it another way. Risk mitigation means something different in domestic violence than it does in child welfare. Self-sufficiency means something in senior services and disability services versus something else in economic development and income support and workforce development. And so how do you create a landscape that is somewhat aligned to answer the question of beneficial impact? And so I just want to say we think we're onto the right track. We've been doing, it's a lot of qualitative work. It's not just outputs and outcomes, not just recidivism. You have to go deeper than that. And it takes a while to create that culture, to ask those questions. So it's fascinating to hear your conversation, because we are in the same safety net communities, right? Poverty starts to look the same no matter where you go. I mean, we also have the complexity of demographics, very, very complex, diverse communities. So I just want to say that this feels right. We created a quality service review tool, and we defined risk mitigation, health and well-being, and self-sufficiency. We gave permission to each of our programs to define under those three subheadings. And then we created a composite, and we said, okay, if we're doing well in risk mitigation, then across our enterprise, this is what that means, and these are the programs that are contributing towards those goals. And so every time we sit in a team meeting, we sort of try to ask the question about beneficial impact and risk mitigation and health and well-being and self-sufficiency. So
Sort of
I just
changing
feel
the culture. as
those
you go along.
three seem to sort of percolate our world. So.
Can you talk about the NAS Seal of Effectiveness?
Yeah, yes, absolutely. That's very exciting. I want to give a shout out to Mark Friedman, who wrote "Trying
Is
Hard
Mark
Is Not
here?
Good Enough."
Lord have mercy,
There's
another
Mark over there.
groupie.
As part of the Promise Neighborhood Institute's STAR training, Skills to Accelerate Results for Promise Neighborhoods, those of us who are in the network. His book was a must-read, and the Annie Casey Foundation training. So thank you so much, Mark. The Seal of Effectiveness is really what I was describing before with using out-of-school time or expanded learning as an example.
Okay.
But we're actually, every single part of our ecosystem, housing, expanded learning, early childhood, they all set shared goals, and then they all created evidence-based plans, or what we call solution plans. And it's on our website.
Got
We
it.
want to share it with the field. Again, all of them have essential ingredients, necessary conditions, dosage. We always ask the question, again, how much, how well, is anyone better off? And we learn as much about what's working. And the thing that's so important about solution plans for us is that we're a collective impact movement. And so for us, the NAS connector, that's the family coach, the academic navigator, that's the scholar coach, our navigators and all of the ecosystem, plus all of our 39 partners, all work together for the outcomes we are looking for. But we need to be effective in every single piece of our ecosystem. And so our results NAS process, which we're actually starting just this month, again, just to reiterate, will be that roundtable of stakeholders, both board members, parents, staff, and so on. But, so the first one, for example, this month will be family engagement. And our family engagement team will come up, we'll look at what our targets were, our benchmarks, did we use the solution plan, which is part of our NAS Seal of Effectiveness, because if you're using it effectively and we learn from it what works, what doesn't work, then we should be seeing the outcomes that we had targeted. And so it's been an exciting and we've been doing it loosely, but we're formalizing it just this month with Results NAS.
Dr. Rob, can you talk a little bit more about that work? It was really interesting about asthma and getting that and working more with the community and what that has been like.
Sure. So one of the themes that hasn't been as strongly discussed today is the notion of denominators. We're all really good at counting numerators, and the numerators in a given program, we can get excellent outcomes. So for our asthma work, we're benefited by the fact that Cincinnati Children's Hospital admits about 95% of all the admissions in the county, right? So with great power comes great accountability. So we can take all those asthma admissions and we map them to neighborhoods. And if you look at the 90 neighborhoods in Hamilton County where we sit, there's 30 to 40-fold variation in asthma admission rates, right? So immediately it takes you from, I'm sitting in my office, what does that next child need that I can easily do, write a prescription, to, oh my goodness, what are these positive deviants who are doing very well, and then what's going on in those communities that are not doing well that has almost nothing to do with healthcare. So what we've tried to do is begin to think at the neighborhood level, very much sort of a place matters. What would it take? A community of Avondale, 200 kids born every year, probably the 89th worst in terms of asthma admissions. Who do we need to partner with to get to much more effective outcomes? So using these basic improvement principles, we've started a partnership with the Legal Aid Society of Greater Cincinnati. It started with a couple cases. We're now 10% of all legal aid societies' business in their region. So we're referring 800 families per year out of our clinic around housing issues, around inappropriate benefit denials, around family custody issues. But you can imagine how important the housing piece of that is for kids with asthma. We're working with Cincinnati public school nurses. We've now trained 50 public school nurses in the model for improvement. And in the process, building that bridge, that connector sort of thing. So we are talking the same language. Literally now, we can round with the nurses virtually on the 5 kids they're most worried about in their school with asthma. So housing, schools, we started to talk with pharmacies. Why aren't pharmacies a part of this neighborhood equation? They're also in that silo, to use that word. I have seen the silo between Columbus and Cincinnati. But they are also, it is that personal connection. When you actually sit down and say, how could we jointly do this better? What does it look like from standing in your shoes? What does it look like from standing in my shoes? And same thing, take 5 kids. How could we manage those 6 kids better? So putting it all together, I think there is still a great leap forward that has to happen. It's this discussion around collective impact or community quarterbacks where you all finally come together. That's our sort of great hope over the next 5 years is literally using the data. Now, every single week, I could tell that team of folks how many admissions there have been from their neighborhood in the last week. So we know every 2 days, on average, there's a child walking in from that neighborhood, and do that sort of rapid cycle feedback to now a well-integrated team.
Great. Other examples, questions from the audience? Is it warming up in here or is it just me?
No, it's warming up.
It's warming up. She's like, no, it's not. Take your jacket off. If you take it off, you'll warm up. There's a hand over here. Oh, sorry. Go ahead, ma'am.
Good morning. My name's Roseanne Renteria. I'm with Phillips Programs in Annandale, Virginia, and Laurel, Maryland. We operate a family strengthening program and a special ed day school. I was wondering about the goodwill piece, because everything you're talking about seems very much like about the organization. So what strategies did you use at the organizational level for buy-in on what I call evaluation goodwill, like willing to do what it takes, to get it done well? And then how do you use what you're learning for strategic planning on program design, evaluation systems, and better outcomes?
Who wants to take that?
I'll jump in very briefly and then please build on it. I thought one of the things that Dr. Rivlin said was really important was that some want to do and some want to study. And I think the challenge for the goodwill piece of it is to close that gap so that every single person on the front line or in leadership says, I have to do my job and I have to make my job better. And then it's not sort of an ask for leadership to review the results, but really getting them trained up. And we've put a lot of energy into building both that capacity and the culture. So roughly 1,000 of our employees have been formally exposed, either through the leadership version or a team-based version, to the model for improvement. I think its simplicity helps bring it in. So it's not fill out this 17-page survey and turn it in annually, but really we're closing that gap between plan and do, and that makes the goodwill needed much less, and it's more mission-driven.
I think I was going to answer too from the Harlem Children's Center. I was lucky that I inherited an organization that has a culture of being driven and driving for results, and that being something that's very important. But I think that even with that, we probably have over 600, Bettina, pieces of different data that we look at in the organization right now. Every single director is really clear about what they're accountable for. But even with that, I think we are an organization that collects a lot of data, but I'm not so sure that we use it every single time to make decisions on the front line as much as we need to. So really focusing on that now is this next part of the organization, and really making sure that that child care worker, that those after-school workers really are clear about what the grades are, what's going on, what are those things, and what their boss, that might be 3 levels above them, is being held responsible for. So I feel as a leader, it's my job to talk about it all the time. And I tried to do that this morning, where I'm saying I talk about individual kids as much as I do about programs, as much about what we're doing well, and spend a lot of time on what we're not doing so well, so that they can see that I have the courage to speak about, yes, we're excellent, we're good at what we're doing, but we are a learning environment, and that we have as much courage to be out there on the streets with the kids as we do to say something's not working, and to have the courage to put the systems in place to improve that. So I think that leadership and that level of not penalizing people, right? Nobody wants to bring you bad news, and saying, no, I want you to tell me what's going on. I want to support you. I want to give you that information. And together, when we say failure is not an option, what it means is that you cannot fail by yourself and not bring something up to me. If you can't solve it by yourself, there's a lot of people, and you can definitely bring it to me, because we're going to be able to solve it together. I think that's what you have to sort of build within your organization.
Absolutely.
Yeah, and across the organizations, I got to tell you, the thing I think keeps everybody at the table and committed to this collective impact, this disciplined approach to changing outcomes for families and children, is that when we were siloed, housing doing their thing, K through 12 doing their thing, colleges doing their thing, behavioral health, everybody pointed the finger at everybody else, saying if only they would do their thing better. we could actually change outcomes in this community, and it didn't happen. And so when the challenge of could we do something like Harlem Children's Zone in our footprint, given our bad outcomes for children and family, we jumped at the chance to do that. But then as we put these disciplined results-based accountability, because everybody wants to see outcomes. We've just never really known how to get them. But now that we're learning together what works and what doesn't work, and we're sharing that information with the field, it's becoming very sexy for people and very compelling that we're getting better outcomes together than we did when we were operating in our siloed organizations. And just one example with our one jurisdictional partner, we went into a partnership with Hennepin County. They said we could enroll like 50 of our families in a pilot to move them from welfare to work. And we got 100 families signed up because we have a data system called NAS Connect where all of our partners share information and we can enroll and get families up and going quickly. But anyway, we had 100 families that we signed up for it. Only 10 were able to benefit from the county's program. And what we were able to tell them, and now we've just been doing this together for 3 years, right? The county's been doing it for about 100 or something like that. But what we were able to tell them was our families, who are your families, are not ready to be ready. Like they don't even have what it takes to get into that training program you're talking about. There's a step back. And the county was like shocked that families weren't ready. And I was shocked that they were shocked. But the only way we came to that conclusion was because we track data, we see what's needed, we knew why things weren't working, why they weren't enrolling, and we were able to share what we were learning on the ground. Since then, the county has changed that program. We're hoping to have 50 families enrolled because they have reconstituted to make it a program that has families get ready to be ready.
Frank has given me a little bit more time, so let's take more questions.
I'm Clint Brass from the Congressional Research Service. So one of the challenges that folks face perhaps at the federal level in state governments or in philanthropy is how to be helpful and not harmful. Kind of, do no harm, Dr. Rob, right? Maybe I can just take the liberty of breaking up the agenda here and go with the question for the next panel. So what can federal, state, philanthropic, and other stakeholders do to support a creation of stronger evidence and not get in the way of good work that you need to do?
Great question.
That's a really great question.
Maybe I can go ahead and start. And so I'll start this from the perspective and as a confession of a former funder. When I was in my old corporate life, I was a funder for a short time. And I have to say, I have a lot of regrets now being on the other side of the check about how I allocated resources. And all of that is to say, now that I'm on this side, I understand so much more the importance of getting out of the way of organizations, allowing them to be innovative and make mistakes. There are too many times since I've been in the social change world that some of our funders have tried to be, and this is my opinion, too prescriptive about what good looks like. These are specific measures, these are specific targets, and this is the time frame in which you need to achieve it. And I have found that so often to be constricting. And we are fortunate now at LIFT to have a set of funders that allows us to take more of a patient capital approach and take more innovative approaches so that we can have more pride of ownership of the results in the long term rather than the short-term results and the how we get there. And so that would be my plea to any other funders to say, if you believe in the model, if it is well thought out, if it is supported by leading practices and rigorous research, and there's a good plan in place and there's a good team in place to really implement that well, take that leap of faith. It doesn't have to be right off the bat from $0 to $100 million. You can take more of a staged approach. But as I think about my old life when I was corporate, I used to lead some entrepreneurship work for the Americas for Ernst & Young, one of the big four professional services firms. The idea of innovation and failing early and failing often was seen as such a badge of honor. And I wish that existed more in the social change world.
Amen, amen. I see my mentor, another one of my mentors with her hands up. Can someone give Angela a microphone, please?
And I just, one other thing I do want to add to that, especially in terms of supporting the collective impact movements, is that, so yes, absolutely holding learning and innovation and evidence and outcomes, right? Holding it all together, but also giving some preferential points to organizations that have actually put skin in the game and are actually creating this collective impact movement and using evidence to drive the solutions that we use to change things for families and children on the ground. Because, we're talking to the feds as well as local philanthropists around. It can't just be NAZ, the Northside Achievement Zone, as the backbone organization that gets supported, but it has to be the partners also that are using evidence to have the shared outcomes. And so it's a little bit of challenge of that happening right now. They'll not fund one of our partners that are delivering outcomes, but fund us.
Angela Blackwell, Policy Link. I wonder if any of you has a story of something that you've let go as a result of using data for continuous improvement and evidence for continuous improvement, because it does seem that there's a tendency to keep improving, right, or at least trying to, right, but maybe the answer is to just stop it.
Yeah, absolutely. Yeah, we've, Angela, let go 2 partners.
Oh,
yeah,
she's like
for example, yeah, absolutely. So the whole NAS seal of effectiveness and using RBA is that, so while we're learning and we're innovating, there comes a point in time where you have to say, if things aren't getting better, if we're not doing better and children are not better off, and we can look at performance level data, then at some point we have to stop working with those organizations, and they should stop being funded. And so there were 2 around one of our mentoring partners and one of our expanded learning partners, where when we looked at the data across, because they're in networks, we had 3 mentoring organizations, and the other 2 were able to deliver outcomes using our solution plan. Same with out of school time, the other 5 were, but these programs, because of staffing and a myriad of other things, couldn't do it. And so we said, as the backbone organization, because we want outcomes for children and families, we'll no longer partner with you. But if you get it together and you want to come back at some point, we'll reevaluate. But right now, no. Right.
I have an example, but Bettina, do you have one that comes to mind from the Harlem Children's Zone?
Got it.
Go ahead, stand up, Bettina.
Well, we have been doing asthma work for a while now. It started out as the Harlem Children's Zone Asthma Initiative and is now Air Harlem. And that was a space where we learned a lot about what worked and what didn't, and what we could do and what we shouldn't do. And one very important example is the work that we tried to do with smoking cessation, where we had this community of individuals who were very focused on trying to stop smoking. They were parents of kids who had asthma, where it was clearly harming their children, and finding out that as an organization, that we really did not have the capacity to help parents to get to where they needed with smoking cessation. It's very difficult work, and we were not able to build up the staffing model with the medical professionals so that we could do that work and support it, and we decided that we were going to focus on what we do better, which is really engaging with the families, doing the education, checking in with medical professionals, and making sure that parents know how to advocate for their kids in those interactions, and letting go of that particular approach.
Yeah.
Can I just make a quick comment on that? Because that very issue, I think, to me, about 10 years ago, struck me for that gap between a randomized controlled trial and what would actually be required to make a difference. So there was a point in early 2000s where if you look through the New England Journal of Medicine and Journal of American Medical Association and all the randomized controlled trials for smoking and their success with a nicotine patch, and you looked at the demographics, though, of who was actually in those trials, completely different reflection than who was still actively smoking. So this notion that just give someone a patch or do the 5 A's of counseling was making no impact when you tried to deliver it. And then obviously, as you're finding, there are many, many, many other barriers to today's current smoking. So to me, that was an example of a gap where you could have an RCT and it bore no resemblance to whether you'd succeed in current practice in doing it. Because those RCTs were probably started 15 years earlier when someone wrote their NIH grant.
For programs, we moved away from, not moved away completely, but with mentoring, we've had, our goal has been every child has a caring adult in addition to their parent or parents. A goal of 100 scholars being matched every year. We've only been able to match 30 a year. And as we looked at it, the community-based model was not working in our context across the board. And so we have moved increasingly to other models like school-based. And so it's a deviation from our solution plan because what we were finding was our solution plan wasn't working in the way we had intended.
There's a question right in the middle here. And maybe one more question, and then I'm going to have a final for you guys.
Hi, I'm Stan Schneider from Metis Associates, and a lot of the data that you've been talking about come from primary data collections, although I also hear snippets of integrating data from administrative data systems, et cetera. And so my question really is, given the concerns about human subjects, protections and ethics, et cetera, do you have war stories or solutions that you can share about how you've been able to access and then integrate unit record data from administrative data systems into your work?
I'm looking at Bettina. Do we have war stories about that?
Our war stories really focus on how incredibly difficult that is to do when you create a 97-block area that is not aligned with school districts or community districts or zip codes or any of the ways that those kind of data are partitioned. So it has been very difficult for us to do that work and to use those data. Nevertheless, we do use Central Harlem as a way of getting a sense of how our community is doing, and as a way also for us to compare how our participants are doing. But it doesn't align as well as we would like it to, and it does cause us to end up having to collect a lot more data than we would like to.
You guys want to add anything?
Well, we have a shared data system called NAS Connect, and the health data is always the challenge, the health and behavioral health, so that's a different animal altogether. But we have an incredible relationship with the school district and with our parents. So we have a little over 600 parents now. We'll have 1,000 next year, and they sign releases of information constantly. And so we're often getting data, able to get more data because we have their releases in hand, and we'll continue to do that. And it's quite a heavy lift. And they actually designate who in our collective impact ecosystem can see their data. So they're always in control of it, but when they need support from housing, they're not going to say housing can't see all of my data. So
I would just add, to avoid war, the work, it slowed us down, right? We're so conscious of HIPAA and FERPA on the education side. And we're just having this discussion now. If I had 60-second look at a child's school record, my encounter with that child of a second grader or third grader might look completely different, but the barriers to doing that quick look are very high, short of consenting.
Right, which we do.
So I wanted to end with this issue of culture. How do you really ingrain this in your organization? And I talked about it a little bit from an organization that's been doing this for a couple of years now, but wanted to talk and see if you guys had any advice for folks in terms of how do you make this just part of what's in the water in your organization?
Maybe I can start and maybe just sort of add on to something that you mentioned earlier, because I think it was such an important point that you made about the importance of leadership. So at LIFT, once we built this program team, unbelievably, we had not had a national program team really until the 14th year, and an evaluation team. And I think there was some reticence, as there are any times you're about to implement massive amounts of change, about sort of what the change means and what does it mean to really evaluate performance at a much more rigorous level. And I think one of the things that really helped us as an organization make it through this transition, and we're still in the middle of the transition, is really the leadership example that was set, not just the tone that was set, not just the rhetoric, but sort of structurally, how did we make it okay for people to not even fail, but to not succeed as well? So just as a quick example, I spoke earlier about these feedback surveys that we do with our members, and if you know Net Promoter Score at all, you know that the range of scores is -100, all bad scores, to +100, all good scores. Generally speaking, for most corporations, a good Net Promoter Score is positive, but really 50 or above is better. Like the highest scoring companies like Apple do 78, 79. I don't think it tops out any bigger than 80. In any case, all of this is to say that at Lyft, we had been getting astronomically high scores for so many of our questions, 70, 80, in some cases 90. And in one sense, I think it made us feel good. There were clear ways where we were meeting the needs of our members consistently, but we also grew suspicious of it. Just sort of, are they being polite? Do they feel obligated to give us good scores because they need us to provide certain services? So we did a couple of things like try to mitigate for politeness bias, but what we also did was work together as an evaluation team to reconstruct the surveys to give people more opportunities to give us bad scores. So for example, instead of asking at Lyft, I'm treated with courtesy, dignity, and respect, we say today at Lyft, I was treated with courtesy, dignity, and respect. So even if in general you think we treat you pretty well, maybe today my advocate was a jerk, and you have an opportunity to say that. And we can say over time, maybe 4 out of 6 times people think our advocates treat them poorly. And all of this is to say we do things like that to give people an opportunity to rate us lower, to give people an opportunity, our teams, to make tough changes that we think will ultimately help our intervention, like increasing the duration of our meetings with members, which reduces the amount of service that we can provide, which reduces the projected number of outcomes and goals that we can achieve. All of those things are really scary to people, but what we try to say is have faith in the process and go on this journey with us. And if your numbers go down in the short term, that is okay, as long as we believe in the process. And I'll just add one other thing to it, which is that, results matter, doing well matters. And so even though we have in the last year made these sorts of changes, like dramatically reduce the number, by 20%, the number of meetings we can do, the number of members we can see, other changes like that that reduce our overall volume, our numbers are up. I just have them here in front of me. We measure progress in a number of different ways, behaviors like action steps and outputs, or much more meaningful measures of progress like goals and outcomes. Our action steps over the last year are up 275%, outputs up 50%, goals achieved up 195%, and outcomes up 79%. And so even though people have made these really tough changes, what they see is that it's yielding results. Now, maybe it would feel a little bit scarier if we weren't able to achieve the results, but I think it's the inspiration that leadership provides, that we are about learning better so we can do better, and these hard choices we believe will be rewarded in the end. It's an important message.
Thanks, Maria. Dr. Rob?
I think a couple of things have been mentioned. Leadership. I mean, every one of our leaders speaks to the issue of improvement. They talk about failure. They're part of a root cause analysis if need be. And it's published on our intranet how many days since our last serious patient safety event, and that helps drive this sense of honesty and transparency. I think simplicity is another one, again, closing that gap between the people who are doing and the people who are studying, and making it, almost democratizing that effort, I think has really been part of our success at Culture. And the last piece we didn't get a lot of time to talk about is this notion of networks, and learning faster and better, and knowing there are great solutions out there, and then including our patients and their families as part of those networks, not just researchers, not just clinicians, but we have some great examples where families are racing so far ahead of us around diabetes care and CF care and bowel disease care, and bringing that in, and that energy, like you said, it feeds back in a positive way.
Finding that good practice right in there. Yeah.
Ditto, ditto. And, again, a collective impact movement across 30 organizations and 9 schools. It's been, again, leadership is everything. So ours is a results-based leadership model. And so we have shared outcomes. We talk the same language. We've agreed on population level changes we want to see versus performance, and what language we're going to use, indicators or not. And so all of that's been agreed on. And so it's just being driven through the community. And the leader of that are our parents. They have also been educated in what results-based accountability is for their own leadership within the community. And then we're marketing our outcomes. I mean, people get motivated when we learn what works together and when we learn what doesn't work together. And we celebrate what's working in the lives of children and families. And so, our whole goal is that every scholar in our footprint in this place is surrounded by a team. And our 30 organizations and 9 schools make up that team. For any individual, like housing might house one of the parents. They're also in an early childhood program. They're also in an expanded learning program. And we have community celebrations, and we we celebrate our parents and the children and their accomplishments. And all of our partners come, and the parents call out the partners who are part of their team. Right? So Urban Homeworks helped me get a house and blah, blah, blah. And so our partners are starting to see that even though, again, we do miss the mark, we don't get it all the time. In the places where we're getting it now, there are 600 families and 1,600 scholars who are better off than before when we were not doing work together in a results-based fashion.
I say success is contagious, right? As is hope. And so I want to, we talked about living in the black box. I feel like all of us are in the black box, which can be messy and complicated. And when I talked about, exactly. But when I talked about leadership, and leadership really matters, I'm so happy that you guys were here because clearly you are doing what it's going to take in order to have better results for children, and this concept of getting better at getting better and making that something that's really important. So thank you guys so much for sitting on this panel with me today.
Thank you.
Thank you.